Hi, Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. July 7, 2020, COVID update. First, big shout out to my staff saying thanks for all the great care of our recently diagnosed cancer patients, all our typical complex gynecological, menopausal, internal medicine, endocrine patients. My staff is awesome. They're wonderful. Thank you for all the work you do. Without you, I would be nothing. Again, thank you to my partners, Ben Berenberg and Cassie Smith, who are outstanding physicians, one in endocrine and one in urogynecology. You guys make the practice get even better. My director, Susan Cox, and my manager, Rhonda Morgan. You all are fantastic. Thanks. Thanks to Kim. Thanks to all our support people, Rune Richmond, and then all the BioT people, Buck, and all of those people who are helping us and everybody else. But special thanks to all the pharmacists who help get our patients' prescriptions filled. There's so many people who make the practice work, so thank you. Just COVID update, not a great day in Oklahoma, 854 new cases, 5 deaths. We're at about 17,200 people in Oklahoma, about 160 plus in intensive care units, about 430 to 50 or maybe 60 in the hospitals. Still plenty of room. Countrywide, about 2.9 million. We'll break the 3 million mark tomorrow. About 131,000 deaths. Saturation of hospital systems in South Florida and Texas, probably going to continue. Oklahoma got banned from New York today, which is pretty funny that New York would ban anyone from coming when they have more cases than any of us in Oklahoma, in a little poultry state like ours. But, hey, that's okay. There's so much politics and this whole cancel culture thing that's going on, where they destroy people or thought processes, and it just it's crazy. So anyway, Oklahomans can't travel as much as maybe they had hoped, but we're still have very low numbers relative to most of these states. If we wear our masks and socially distance, we will do much better and we'll lower our case counts. Dr. Toner from Johns Hopkins gave a great interview yesterday, which I'll talk a little bit more about tomorrow. But bottom line is he's gamed the pandemics, a bunch of them. He interestingly gamed a pandemic on coronavirus last summer with NIH, CDC, and FDA. And as he said in his little interview yesterday, kind of the government's blown every aspect of this. And he's not talking Trump or just NIH completely. Now, he said it very politically correctly, but they pretty much we're in last place as a country in the world for how we've managed coronavirus. And I put that all squarely on Dr. Fauci and Dr. Collins from the NIH and Dr. Redfield from the CDC. They're the ones who blew it. There's still no guidelines. That's one of the things that I was talking to a physician about today who's had several COVID patients and who's doing a great job managing them. But he said, I have no guidelines. I have nothing. I have to do it all because I'm reading journal articles like you are, Noel. But he's actually a real doctor. I'm a real doctor too, but he's a real doctor because he does primary care full time with pneumonia and all this stuff. So he's like, I have no guidelines, which is my point. There's no guidelines. So anything he does, he's walking out on a limb where if the patient doesn't get better, there's tons of lawyers who will sue him. And even worse in some respects, is there's tons of doctors who are going to criticize him because as he said, well, this one patient he was going to send to the ER today because he got him on Plaquenil, but it wasn't until Saturday. They were day 9 or 10 of their symptomatology from their COVID infection, and they haven't responded. So he was checking on them and felt like they needed to go to the ER. And his comment was, when he hits the ER, the first thing the ER doctor is going to say, oh my God, the guy got put on Plaquenil. You got put on Plaquenil. Your primary care doctor is terrible. I mean, that's utter nonsense because his primary care doctor had the cojones or the backbone to do the right thing. He just got the guy later than we wanted. We want to get this stuff started within day 4, day 7. Well, you start getting 9 or 10, it's not going to be as responsive. So with the Plaquenil. So, that's the problem. There's so much intimidation to these doctors to get things started. Then they have to worry. And so what do we do if you can't get Plaquenil? Is my question tonight. what do you do? So the first thing is you have to be on zinc every darn day. And if you get symptoms, pulse the zinc. Take 50 milligrams 4 times that day that you feel the onset of any symptoms. Then you take 2 days off. Number 2, make sure you're taking your multi. Make sure you're taking your vitamin D. Make sure you're taking your elderberry. The other thing, and I don't think we need elderberry all the time, but maybe get some. So if you do get cough, cold, congestion, add some elderberry. But the other thing is this vitamin C. And I think the data on the vitamin C, which has been very positive for inflammation, what can you do at home with vitamin C? Take 3 grams twice a day if you start getting sick. You don't need to do that if you're not sick. Just take 1 gram a day. But if you're on a multi, you're fine. But if you're actually getting sick, take 3 grams twice a day because you want to stop the inflammation. The FDA started a phase 3 trial for a rheumatologic drug that blocks interleukin 6 today. Interleukin 6 is one of the mediators for cytokine storm. I've talked about it in the past along with interleukin beta. This is some really esoteric molecular stuff that's interesting to nerds, but it's what kills people with COVID. So what interrupts it naturally? Melatonin. So if you always have lots of melatonin, you are not going to have as much risk for getting super inflamed. So again, melatonin, but if you start getting sick, let's amp up the dose to 10 milligrams a day. Because if you can't get Plaquenil, you need to start treating yourself since doctors don't have any options or normograms or things to follow because the FDA and the government has abandoned us. Now let's talk about things that are more positive. We have some great doctors here in Oklahoma. If you ever get COVID, we're in the right spot. I mean, the hospitals are awesome, whether you're in Tulsa or Oklahoma City area. We have great infectious disease doctors. Big shout out to Dave Chansome, Emory grad, who I've talked about before. He was on the Rachel Maddow show, essentially, national recognition. We're hoping he'll get on Hannity next to his friends, but we're very excited, and it's a great recognition for David because he's really been a leader in the fight and is brilliant and a wonderful man. So a lot of kudos to David for getting that recognition and actually being referenced as a true expert for COVID. But there's lots of people in Oklahoma City who can take care of you if you do get sick, but we'd like you not to get sick enough to get to the ER, which always you have to understand. Other doctors who criticize people like me or the other few of us who are willing to put people on Plaquenil or do something to prevent infection don't necessarily always understand what we're talking about because they haven't read and they're just reactive. Likewise, if you want to be put on Plaquenil, the worst thing you can say to your doctor is, I've been watching a podcast or a video by Dr. Noel Williams, and he says, if I get COVID, I need to be on Plaquenil. That is not going to make them happy because doctors are doctors. So what you have to say instead is, hey, I would love to talk about Plaquenil. And I've read stuff and I see there's mixed data, and say, I would really like to get 200 milligrams twice a day for a week now that I have COVID. I understand there's some cardiovascular risks. I'm not worried about them. Put that down in my chart. I agree. Take my picture if it's a video appointment, because that's what it will be, and just say, hey, I'm willing to take the risk. Okay? Because it's a teeny risk. It's like 1 in a million. So it's not even 1 in a million. But whatever. So the thing with doctors, you have to know how to manage them. Be nice to them. Don't threaten them by telling them, I've read this and I need this. Say, I maybe am aware, and be gentle, and you can bring them along, like leading a horse to water. So that's what I would encourage for everyone to get on Plaquenil if they have to talk to their primary care doctor. What am I missing, Kim? Was there anything else I needed to bring up tonight, or is that about it? Oh, big shout out to Caitlin Hendy in our practice, who's one of our outstanding MA superstar like all the others. But Caitlin caught a 25-inch trout out of a stream in Steamboat last week, and as a fly fisherman of mediocrity, I'm immensely jealous. I've never caught one over really 20 inches. I'd like to say 21, but 20. So that is a big fish to catch, and she did that by herself. 15 minutes, didn't lose it, brought it in, great pick. I'll try to get her to send me a picture, and I'll post it tomorrow. It's a real fish, and so us fisherman type people love seeing those real trout come in on a fly line. And that's really about the end of it. Stay positive, take your vitamins, and just wear your masks. Masks matter. And as Dr. Toner said in his summary, people who don't believe in masks will learn the benefits when they see either they get sick or they die, and then their friends at least will learn, or family members, because masks matter. The more people who are wearing masks, it limits the spread. So I would leave you with that. Wash your hands, take your vitamins. Good night.